I am honored and excited to have this opportunity to share highlights from this past year of all the important work of the Seven Nations and our Interior Region FNHA team. I want to extend my gratitude to the First Nations leadership, communities, and all those who have contributed to our shared vision. I acknowledge this past year has been challenging and one shaped by the public health and climate change emergencies that are impacting First Nations communities across the Interior Region. I raise my hands to everyone who dedicated themselves and their work to meeting the immediate needs of those communities who were impacted, as well as those who supported business continuity, ensuring that community programs and services were not interrupted. This year, the First Nations Health Authority Interior Region has taken major steps alongside our partners and following the lead of the nations to effect real change in community. We continue to walk alongside and support our communities through this continued toxic drug emergency, providing services and supporting the building of new infrastructure to address this crisis. This year, we celebrated the groundbreaking of the Seven Nations Soaring Eagles Wellness Center on Yakanuki lands in Ktunaxa Territory. This center will offer culturally based treatments to support First Nations on their healing journeys with substance use. Once built, this center will provide clients with an 8-week comprehensive program that addresses trauma and the root causes of dependency. Our response continues to focus on harm reduction and meeting individuals where they are. Our mental health and wellness team is supporting nations in the development of harm reduction work plans, as well as our FNHA Westbank and Kamloops offices are now registered as harm reduction supply distribution sites. Our mental health and wellness team is also supporting nations in developing crisis response plans. They have developed and are delivering frontline education and training, including the Not Just Naloxone training. They also developed a webinar focused on reducing stigma, along with providing education and awareness on opioid agonist therapy and withdrawal management. This year, we celebrated a significant milestone with the opening of the All Nations Healing House in Williams Lake. It is the first net new First Nations-led primary care center in British Columbia. This innovative center provides culturally safe and trauma-informed primary care for Indigenous people and their families. Indigenous ways of knowing and being are the foundation of the All Nations Healing House. This includes elders, traditional healers, and other Indigenous care providers as core members of the healthcare team who work in close collaboration with family doctors, nurse practitioners, and other providers to provide holistic health and wellness services. We would like to thank the Dekeltene, the Squamish, and the Silcotin Nations for their commitment and perseverance in standing up the All Nations Healing House. Communities are deeply impacted by the devastating discovery of unmarked graves at former residential school sites. This year was an announcement of $12.5 million in funding from the Government of Canada to support the construction of a new healing house into Kamloops, Squamish, and this project will be carried out in partnership with the First Nations Health Authority. The Healing House will provide a safe and supportive environment for survivors of the Kamloops Indian Residential School, including their families. The center will offer trauma-informed programs that aim to foster spiritual, mental, emotional, and physical healing for individuals and their families. Our regional team has been collaborating with Interior Health to better communicate, coordinate, and meet community needs during environmental emergencies. Building on the coordination and collaboration during the COVID-19 pandemic, a joint approach has been established to streamline activities. The goal is faster information sharing and more immediate response to First Nations communities during emergencies. A new mental health and traditional wellness role has also been added to the health emergency management team. This new role is intended to support communities during all phases of emergency management. I would like to conclude by acknowledging the leadership, health directors, our Interior Region Nation Executive, Interior Region Technical Table, and Nation leads for their continued guidance and commitment to this important work. We thank you. To find out even more about the progress made throughout the region this past year, Be sure to read the full 2022-23 annual report at www.fnha.ca.